For those of you who don't know me, I'm the Manager for Service Improvement here at DHSV, which means that I run the team for accreditation. Does anyone know Marion Beattie? Yep. Anyone who's gone through accreditation, of course, and anyone who's preparing for it. We're very fortunate in Victoria, and we're greatly envied across Australia, I can tell you, because of having that resource, and I suppose also just more broadly the situation that Victoria is in. So if you feel hesitant or unsure as you approach accreditation, there are many organisations out there a lot worse than you, I can assure you. My team are also the ones who manage all of these new communication channels that Lisa and Robin and the team are opening up for us. And you know, in this new information age, there's ideas and opinions coming to us from all directions. I think that idea around course correction is really a great one to pick up on, and it's an important way to view all of those different ideas coming at us, because the more we see them as opportunities to respond, the more we look to be agile in the way we view that kind of information and people's opinions, the more we are able to get away from the situations where the patients know something's wrong and our staff know something's wrong, and yet as an organisation we're still somehow not able to respond to it. And so a good complaints policy is I guess, that's one of our key aims. I started work here in January this year. I come from an acute health background, and health service performance is sort of within that, specifically around emergency department redesign and elective surgery waiting lists. So I guess like a lot of people in that line of work, I've always considered myself to be pretty patient-centred. But as you get more and more into these new national standards for accreditation, you start to find, oh, that's not me, beg your pardon. There we go. You start to find that you're questioning around some of those ideas around consumer engagement, and really what does it mean when you really get into it and ask yourself, how are we engaging with our consumers? Has anybody else had that experience? With the new national standards in particular, I mean, it's just all over the place. That's good, I'm getting a few nodding heads here. I mean, the one where you can't now release a document that's visible to the public unless you run it by a consumer. Have people encountered that? You know, it's a little frightening, I find. And while we've had a consumer advisory committee for quite a while now, we're now getting asked the hard questions around, but are you listening to them? Are you responding to them? Are you actually changing the way you govern your organisation in response to the findings of that committee? So it's certainly a big challenge, and I guess one of the aha moments for us, or for me, came in the work that we were doing on complaints management, which is really what I'm here to talk about today. And that was, we get a lot of complaints here, and I'll tell you what, we get some pretty hairy complaints, and that's really been something that I've had to learn quite quickly to respond to. But one of the things that came out of a couple of those experiences is again, something you mentioned, Lisa, that there's often not a lot of difference between a complaint and a compliment, and that what can start out as just a situation, well, it may come as quite a confronting situation, but most of the time a complaint isn't a statement, it's a question. Someone's asking you something. And if you think about it, it's while we take the complaints quite personally, they're not directed at us, they're directed at the organisation. The person's asking you something because they think that you can do something about it. This next slide, keep doing that, don't I? Right, there we go. This next slide I made up with my team a little while ago, and this was one that I think kind of captured the sense of what a lot of us feel when we start trying to layer consumer engagement on top of everything else that we do. Does this look familiar to people? You know, we're told to produce, get on with it. And then now on top of all of that, but also take time to just stop and smell the flowers and talk to your patients. Now, of course, what you're supposed to do is be very disciplined around the way you document things and use all the tools and that. And ideally, what they should do is all neatly stack up just like that and support you in your work, like this happy chap here. Now, I'm not going to go into the importance of documenting your work in this one. Your poor quality managers can have that particular task. My guys are busy enough with doing that at RDHM. I will say that if you're not documenting complaints and compliments on the day, if you're not putting them in VIMs and you still think that you're somehow patient-centred in your approach, you're just not in the picture. So we'll move on. This is what it looks like, isn't it? You've all seen this person. They come at you, they're all kinds of crazy. And how do we respond? Well, we respond personally, don't we? This person's in my face. They're all over me. I guess the first thing is going back to what I was just saying before around they're not upset at you. This isn't personal. In fact, they're coming to you because they think you can do something. And that's a really important thing to hold on to as you go into a conversation like that. Obviously, we deal with the poorer members of our community, more challenged members of our community. And these are the things to firstly keep in your mind when you enter into that kind of an interaction with someone. Finding the reason why that person is coming to you, what the question is that they're trying to ask you, is sort of that first step you can take to understanding why, what their response is. And the way to get away from this being a potential complaint and into something where you can resolve a problem. We've been developing a complaints management policy, and as I was saying, we're now at the stage where with all our new staff coming on and our new structures going into place on the 1st of July, we're working very closely with the managers of those areas to take that on. And central to it is this notion that our staff member should be able to manage the situation right at that time. So whoever you are, the first question you're asking is, why is this person talking to me? And that may not be immediately apparent. You may have to tease aside a whole bunch of other issues and questions, and that, as we've said, that can take time. But coming to that kernel of truth that people talk about is an absolutely vital skill in what you're doing. And then I suppose the result of that approach is that you start to take responsibility for the conversation. This isn't this person's problem. This is your problem. Or rather, this is your opportunity. There's some piece of information here. There's something that we can respond to. And making that clear to the patient, you might think that this is the most stupid thing in the world that they've got, that they've got their knickers in a twist over. But if you make it clear to them that you are going to take that on as your personal responsibility, this is a great relief to people. So what we're talking about here, and I guess getting back into that broader notion of consumer engagement, is that healthcare is all about shared responsibility. We have a responsibility as the people who usually know what's going on and can control the outcome of an event, but the person has their own responsibility and their own pressures. So recognising that everything that you do in the way you work with your patients is contributing to that, and always looking for what is it that's causing them to go all crazy is the thing that's always in your mind. We're trying to get away from that personal response and ask ourselves rationally, what is it that people want when they come to us with these issues? And hopefully it should be no surprise that it is just these fairly simple things. And we've got compensation down the bottom. Most of the time that's not what people want out of a poor interaction. They're really usually looking to be understood. They're looking to be told, no, you're not crazy. And of course, the other one is that we've heard you, and next time you come, this won't happen again. Or if somebody else comes and they're in this situation, it won't happen to them. And that comes back to that notion of being agile and responsive. So we try to be very direct, I guess, in the way that you tell them what you're going to do. Respond to what they're looking for. Obviously not making them feel as if their problem's not important. Being very realistic around what you can do, and working within timeframes. The worst thing is we've all experienced when you're trying to deal with someone that you're unhappy about the way they're acting is when they say, yeah, I'll get back to you on that, and then it's up to you to chase them again. So I guess that's pretty well the thinking so far. Very interested to hear what other thoughts there are out there. I know that this sort of consumer engagement may be quite different from those of you, particularly those who work in a more community setting. But I guess this is where we're really at, this recognising that the ways we measure patient satisfaction, you know, the surveys and the patient experience trackers and all of that, they have a fundamental problem with them in that they take the dialogue out of the patient's mouth, out of the patient's words, and they put it into our words. And that's ultimately disengaging. The very best, the richest source of information is happening when the person is voluntarily giving you their feedback at the time when they want to do it, about the things that matter to them in their own words and at their own pace.